Hello friends, I am Dr. Akhil Kulshreshtha. I am a senior consultant orthopedics and joint replacement at Yashoda Super Specialty Hospital, Kaushambi, Ghaziabad. Friends, today I am here to talk about some infections, important matter, which are the infections of bone and joint, and how are they caused, and what are the importance of bone and joint infection, and how is our hospital the best hospital to get treated for such diseases. So dear friends, you must have heard that a lot of knee joint and hip joint replacements are being done these days. Most of these surgeries are performed well and they end well. The patient is good and happy. But sometimes there is a failure rate in which we do find that there are infection in these joints. Sometimes infection are also seen in other bone related matters. How are the infections in bone and joint different from infection at other places in the body? Friends, bone and joint infections are much severe than other infections of the body. The reason being that the penetration of antibiotic is slow into bone as compared to other places. So once we know that these infections are severe and critical, so I would like to tell you that these infections should be taken very seriously. We at Yashoda Hospitals are fully equipped to deal with these infections. In fact, we do receive patients from all over the country who are suffering from such type of infection because surgery done somewhere else. Now how are we equipped to deal with this? First of all, investigations are done to establish where is the infection and what is the rate of the infection. For this, we have a fully equipped pathology and microbiology department which takes care of all the investigations which are necessary for achieving the diagnosis of these infections, namely the culture, the pus culture and sensitivity test. We have the latest and advanced equipment to diagnose that. Then we have other blood tests which are conducted and which especially to establish the diagnosis of infection. Once the diagnosis of infection has been confirmed, then we also have other radiological tools with which we can manage small infections like X-rays, contrast X-rays, and then we have ultrasound for deep-seated infection, which tells us where is the pus. And in the last, we do have MRI, state-of-art MRIs, which help us to diagnose deep-seated infection as well as particularly the infections around the bone and the joint replacement sites. We have facility for contrast MRI also, which clearly and very specifically tells us about infection, what type and where to find it. So friends, we see that our hospital is very well equipped as far as the investigatory tool is concerned. Then comes the treatment part of the infection. So friends, led by me, we have a very qualified and highly experienced team of orthopedic surgeons and joint replacement surgeons who are always in their endeavor, who are leading in their endeavor to treat such infection vigorously and not to let the infections spread at other sites in the body. For this, we have special operation theaters in which we take the patient and do the necessary treatment, which may take a few steps, which may take a few visits to the operating room. Apart from this, we have another team which looks into the dressing part of the patient, which is very important once we have finished with the cleaning part of the infection inside the joint. To take part of post-operative period in when the infection has been eradicated, then we have a very dedicated physiotherapy team which also helps in letting the patient rehabilitate, and also we have other supportive staff which tells the patient how not to how to do things so that he or she may not contact infection again. So friends, I would suggest that God forbid, if you or any of your near and dear suffer from any infection in bones or joints or joint related diseases, then do consider to visit Yashoda Super Specialty Hospital, Kaushambi, for complete and quick recovery. Thank you.